Hello and welcome back to America's Forum here on Newsmax TV. I'm John Bachman. We turn our attention now from taxes to Obamacare. The president now claims that 4 million people have enrolled for the massive expansion of government health care, but there are also other health care stories to talk about as well. What began as an ear infection for one Seattle 4-year-old soon became something much more serious. Kate Fink's eardrum had ruptured. Her doctor recommended a specialist at Seattle Children's Hospital. The care was authorized by her mother. Sarah's insurance, though, was through the Washington State Healthcare Exchange. But 4 days later, the same insurance company sent her a letter denying the coverage. That letter says the hospital is out of network. The reversal, unfortunately, is not an isolated incident.
The exclusion of a major provider like Seattle Children's from a major insurance network in this market is unprecedented.
Now, the hospital is suing to be included on Washington State's healthcare exchange plans.
We're seeing denials of care, disruptions in care. We're seeing a great deal of confusion and at times anger and frustration on the part of these families who bought insurance thinking that their children were going to be covered, and they've in fact found that it's a false promise.
Well, the Affordable Care Act was supposed to, of course, provide a wider choice of doctors and lower premiums, but insurers say it's simply too expensive to do both. As a result, the number of in-network providers is shrinking nationwide.
There's no better example of these failed policies than President Obama's namesake legislation, Obamacare. This law promised to make things better, to lower costs for consumers, and improve the quality of care, all the while cutting health care spending and saving the federal government money. We now know the sad reality of Obamacare. Lose your insurance, lose your doctor, lose your job.
That right there is Congressman Tom Cotton running for Senate in Arkansas, echoing the sentiments of many Americans on Obamacare. And now there's this. The Center for Medicare and Medicaid Services just released a damning report stating that 2/3 of small businesses will see an increase in health care premiums under the president's health care law. Joining us now to discuss this hotly contested issue is Congressman Randy Hultgren, also David Patton, Newsmax Magazine senior editor. Congressman Hultgren, we'll get to you first. The president today touting his enrollment numbers, saying that 4 million people have signed up for Obamacare, but this is still far from the projected goal of 7 million enrollees that they were hoping to reach by the end of March. These numbers we're hearing from the White House at this point, do you think they hold any water whatsoever?
Well, it's hard to know how they're coming up with these numbers. The numbers we're hearing kind of at the same time, which you wonder if it's a distraction. We just heard the CMS report reporting that premiums for 11 million people are going to increase under Obamacare. We were promised so much from the president, from others, that if you like your health care, you can keep it. With Obamacare, with the Affordable Care Act, your premiums would go down, deductibles wouldn't go up. We're seeing just the opposite happen, as that really sad story you were telling about that child with the ear problem, losing the ability to see specialists, to see your doctor, plans being canceled left and right. That is, we're hearing it from so many of my constituents just in the western suburbs of Chicago. So many unfulfilled promises and questions about the numbers coming from the White House, and feeling like an attempt to switch the subject.
Yeah, let's talk about this new report, which, bear in mind, is supposed to be a non-partisan organization. It directly contradicts the president's promise that premiums would decrease under his health care law. How long do you think the president can kind of keep up this bunker mentality on this issue before he has to address the American public, and before some of those Democratic senators like Mark Pryor, who's running against Tom Cotton, we just heard about, have to kind of step up to the plate here and just say the president was flatly wrong? Some of them are doing this, but not in such a direct way.
Yeah, John, that's the key. You know, the president isn't running again. He's lame duck and doesn't have another election ahead of him, but certainly the Senate does. And many of these senators that are in tough elections were the ones that were very outspoken, saying, hey, if you want to keep your health care plan, you can keep it. And we're finding out that all that is not true. So I think that's where the pressure comes to have some real change, is these senators stepping up. Many of those who supported it were out there truly on a limb supporting this, and seeing that limb is crashing, and hardworking Americans are feeling the crush of that, the brunt of that. So I think that's where the pressure is going to come. We're going to continue to do our work in the House of just pointing out all of the problems there and providing real solutions, and that's what I'm excited about, is putting together plans in the House, working with hopefully our Senate colleagues, to say there is a way to address real problems with health care. The fact is, this isn't it. Bigger bureaucracy, huge additional costs, losing your coverage, losing your doctor is not the way to solve this problem. But we can solve it. We can address the problems that are there, bringing down the cost of health care, making sure that it's doctor-patient focused. That's what we want to see happen, and not bureaucrat-focused. So I'm not sure how long the president will stand on this. Ultimately, it's going to be senators feeling pressure from their own constituents and their own elections that will push the president to act appropriately.
Yeah, and these races are heating up, as we mentioned. I want to bring in David Patton in just a second, but real quickly, just one more question for you, Congressman. I wanted to ask you about some new information that we also received today, and that is that security experts warned that 35 state healthcare exchange websites were vulnerable to hackers and rated as high risk for security problems before the Obamacare website launched. Yet the administration went ahead with the plan anyway and the website anyway. What was your reaction to that? This just shows kind of maybe some reckless disregard here for the safety of these Americans.
Yeah, huge concern. You know, it's the largest collection of data in memory, and I serve on the Science, Space, and Technology Committee along with the Financial Services Committee. But on the Science Committee, we had people come in to talk about how the real threat to people's information. One of our witnesses talked about this being a hacker's dream, that to have this amount, this volume of information, personal, pertinent information, that really is not protected. It is very scary, and it's really upsetting to me again, once more, that the administration, many people knew that the security wasn't in place. They knew that, but they pushed it forward. That's a huge problem.
Congressman, we've got about a minute to go. I wanted to give David Patton a chance here to ask you a question real quick.
So, Congressman, given this disastrous not only rollout, but the ongoing parade of horrors that the American consumer sees coming out here related to Obamacare, what's the GOP alternative at this point? Where do we stand as far as a Republican counterproposal, if you will?
Yeah, I'm excited. You know, over the last few weeks, we've had so much discussion on this, and it's something I've been pushing for. Is it's not enough to say, let's get rid of this law. What we have to do is, what's the right approach to addressing health care? And we've got a great caucus of doctors who serve in Congress who've helped fashion ideas that would bring down the cost of health care, still making sure that people can get access to care, but something that will really be available to them, finding out what the drivers of cost are. We see so much in lawsuit abuse that's driving up cost.
Yeah, Congressman, a lot of folks waiting to see that proposal. We do have to run. Thank you so much for your time, sir, and your insight on Obamacare, an issue that's not going away clearly, and we hope to have you back to discuss it more in the future. We want to hear from you as well. What do you think about these increasing amount of stories about people having problems with their health care? Are you experiencing any issues? Write us directly. Me at Twitter, at JohnB_Newsmax, or any of us here at the program, at Newsmax TV.